watching the Baltimore station that works for you. ABC2 News. Good Morning Maryland at 9.
Color blindness is a condition affecting millions, but for many of us, we really don't understand exactly how it works. This morning, Dr. Lauren Gormley is in from the Cats and Eye Group, and this morning to talk about the condition and clear up any confusion that may exist. Good morning.
Good morning.
And to that confusion, talking about that, a lot of us really don't understand. This is not a disease at all, is it?
Correct. Color blindness, one of the main misconceptions about it is people think that it is actually a form of blindness. And it's not a form of blindness at all. It's a deficiency in the way you see colors. And even in that spectrum, a lot of people will see many colors and will even be able to identify all colors, just not the same way that other people can.
Now, if someone lives their entire life and say that the most common colors are red, yellow, blue, and green, for which they will be colorblind. Well, if from birth you never recognize that color and you don't know exactly what it is you're looking at, how do you know you're colorblind?
The easiest and fastest way to know you're colorblind is if you're a parent and you have a small child, before they enter into any sort of schooling, you take them to get a full comprehensive eye exam. They will get their color vision tested then, and it's extremely important because so many learning cues and visual aids are color related for children that young that it can actually set a child back if they don't have that comprehensive eye exam at that young age.
Now, in terms of the tests and what people have to do in terms of the exams, what causes it? What causes color blindness? As you said, it's not a disease.
No.
It's just a deficiency in the way part of your retina formed, is that right?
Correct. So in your retina there are what are called photoreceptors, and there are two types. There are cones which see specific detail as well as colors, and then there are rods which see motion and more detail in the dark. The cones are what control your color vision. So if you have a deficiency in your cone function, that is when you end up with color blindness.
Now, the cones and rods, that's something that we deal with and we've learned about with animals. Dogs and cats, they don't have the same, so they don't see color as well. This is similar?
It's actually a funny fact in that humans are one of the only mammals that actually perceive color.
So there you go. Something we didn't know. Something we did not know.
Fun fact.
Now, in some of the more extreme cases, is it possible that someone can only see black, white? I mean, almost like their life is a black and white program?
That's absolutely the case. 1 in 30,000 people have true color blindness, meaning they see everything in a grayscale, like a black or white TV. These people know that they have a color vision problem. They also have other ocular problems going along with that. So that's not going to be one of those people who's going to go through the first few years of their life not knowing that they perceive color differently.
Now, is this a circumstance where someone can receive treatment for this? Is there something that can be done to help correct or in some way alter it? Or is it just a manner by which the person is going to have to learn to live with this the rest of their life?
That is an excellent question, and there really is no cure for color blindness. There are certain tinted contact lenses as well as certain tinted glasses that you can use to help perceive color. But before coming here, I had a conversation with someone who told me that if his color deficiency could be corrected, he actually wouldn't correct it because it would completely change the way that he identified colors right now.
All right. Dr. Lauren Gormley, thanks for the time this morning.
Thank you.
This interview is going to be on our website, abc2news.com. If you missed any part of it, we'll have the answers for you there, so go check it out. Megan?
All right. Thanks, Charlie.